Dr. Jay Burton is a primary care physician and cancer survivor. After battling leukemia, he discovered there were not enough resources for people to help them after treatment, so he founded Survivor Journeys, a nonprofit cancer program that offers support groups, a mentoring program, and professional development workshops. This weekend, Survivor Journeys will host a workshop, Cancer Survivorship 101, at Max's Tavern in Springfield. Carolee McGrath sat down with Dr. Burton to learn more.
Before 8 years ago, this was not on my radar at all. But in May of 2010, I was at Long Meadow Days, and my wife said to me, "You always complain you don't have enough time to donate blood. Go donate blood." I said, okay. So I went in, and they stick your finger to look for some basic hematological parameters, and they said I was anemic and that they wouldn't take my blood. Well, didn't tell my wife anything about that, but 2 days later I came into the office and had a regular blood test, and the anemia was the least of my problems. It turns out that it looked like I had a form of leukemia. My world became a whirlwind. Who do I tell? When do I tell? The diagnosis was acute myeloid leukemia. So anything that says acute at the beginning means you have to do something about it quickly. 10 days after I was diagnosed, I started chemotherapy, and I did that at home because I felt fine. And I didn't want to increase the risk for infection by being in a hospital if I didn't have to. The type of leukemia I have, the decision about treatment is based on genetics. And you either have favorable genetics, intermediate genetics, or what I like to call crap. And I had crap. So what that meant was the option really was I had to have a stem cell transplant.
You have a mentoring program. Why is that so important?
Not all forms of therapy meet the needs for each individual person. There are some people that do well in support groups. Others don't even want to go. The mentoring program worked well for me. It gave me a sense of comfort. I could understand it better. And it made me realize I had no choice. That's something I had to do. I found out later that the transplant oncologist said, if you don't have the transplant, there's about a 5% chance of you being alive in 3 years. That's just being alive. It doesn't say anything about quality of life. If you do the transplant, there's a 60% chance of being alive in 3 years. I was never very good in math, but I could figure that out. So if this worked for me, I had to think that there are people out there that would do well with this form of support in mentoring.
How do you help people navigate through disability and other employment issues that come up as a result of being sick?
It's very hard. First of all, you don't feel well. So when you don't feel well, your focus can be diminished. You also lose control of your life, which for some people and most people, that affects how you interact with others, whether it be people in your family or at work. It's very difficult. So I think that advocating for yourself comes from within. It comes from being educated. That's another reason we're doing Cancer Survivorship 101, because we have cancer-specific support groups, we have a caregiver group, we have an adult mentoring program with national ties, we have pet therapy program. But to optimize the effectiveness of our groups, we have to educate the survivors about the definition of a cancer survivor and the definition of cancer survivorship. If you know those things, then it's so much better in terms of moving forward, because you try to eliminate the fear every day of being a cancer patient or during or after treatment.
You also want to start a program for young adults. This is so important, especially as kids are coming out of care that they would have received under the supervision of their parents, maybe now moving into college or getting a job.
Very complicated age group. A lot of people want to put cancer behind them. This age group certainly is at the top of that. Their social lives are very important. They may be in school. There are so many things that they really haven't even gotten started on in their lives. To come to a meeting or whatever is not a high in their protocol. So this is not the type of group where you sit down and you sit around a table. This is a type of group that you have events. You make it so that people feel that they want to be a part of it. But it's very hard if you're dealing with parents, single parents, people going to school, you have jobs. This has been a challenge for us, but we're really committed to doing this. There are people who have had cancer that are the same ages as my children that are now adults, and they're busy, and they're trying to get on with their lives, but unfortunately they may have consequences from their cancer or their cancer treatment, and we just want to try to help them get over that. If you know more information, it takes away that fear, which is very important, and that's empowering, and that's how you can advocate for yourself.